Hello, Carly Gordon here with David Little, our Executive VP of Communications and Programming from North Valley Community Foundation. Hey, David, how are you doing
Hi.
today?
Great, Carly. How are you?
Good, thank you for being here.
You
So
bet.
today we are going to talk about a brand new collaboration that David was a huge part of bringing together. It has to do with producing face shields for our region that is in need during the coronavirus impact. So if it's okay, David, I'd just like to ask you a few questions about how this all came to be.
Absolutely.
So how did the collaboration begin and what partners have been involved?
So it started with, right when the stay-at-home orders were ordered, some local hobbyists and designers and engineers started working on personal protective equipment for healthcare workers because they heard there was some trouble getting it. These hobbyists figured out, started with Idea Fab Labs working with kind of some open source design plans on how they could print out shields, the visors for the shields and the shields themselves, um, with a 3D printing process. So they started with the 3D printing process. Chico State and their professors and students who had 3D printers started doing the same, using the same system. They worked through a lot of different iterations of the shield, working with Inlow Medical Center to see what would work best, and they arrived at a shield that they could produce. The problem was, even with these 3D printers, they could only produce in the neighborhood of 20 a day, and the need was in the thousands, so they had to figure out another way to do that.
Oh, wow. That sounds complicated, but you guys came together and made it happen. So how many face shields are being produced, and then how did you guys determine the need?
So right now, we looked at county public health departments in the four counties in our area. That's Butte, Glenn, Tehama, and Colusa. They all surveyed the healthcare workers, and that includes dentists and healthcare clinics and hospitals and doctors' offices. They surveyed all of the ones in their counties to come up with a number, and the total between the four counties was 20,000. So then we reverse engineering things, realizing we couldn't do it with just the 3D process. Chico State volunteered to step up with an injection molding process that now allows them to produce 600 in a day, or about 3,000 in a week. They're also hoping to perhaps double that effort and produce up to 6,000 in a week, which would be really remarkable.
That's incredible. So from your research, out of the four counties, Butte, Glenn, Tehama, and Colusa, who has the highest need for these face shields?
Butte County does by far, and that's just because it has the highest population as well. A little over 1/3 of the 20,000 will be going to Butte County medical workers. The first ones, however, are going out and may even be out as of today to Colusa County because they were in the most dire need. They had next to nothing when it came to face shields.
Wow, that's amazing. This is meeting that need. Why did the collaborative decide to produce face shields instead of N95 masks or PPEs, personal protective equipment?
Yeah, that's a good question. Um, Face shields were something they could do. I mean, obviously they wanted to help. Chico State Idea Fab Labs. Idea Fab Labs started out doing cloth masks. And as you see, cloth masks are easier to make yourself or find actually on the internet because so many people are producing them right now. Face shields were another matter. Face shields are just, it's a shield that goes over your face and they're meant to be worn with other forms of PPE. So doctors will have gloves and gowns and masks or N95 masks or surgical masks, and then a face shield covering it all. But face shields were the ones that were something that could be produced and also a great need out there. N95 masks would be great, but it seems like if you have all the money in the world right now, you still can't find an N95 mask. So that will be the next need, but there's nobody locally who is producing or can produce N95 masks.
I see. So from its inception, how quickly have the face shields been being produced? And obviously we know today might be the first day that they're being distributed, but how quickly did the collaborative pull this together?
So we've been talking about this probably since March, and it was refined and refined and refined. It wasn't until probably the last month where we really ramped up in earnest and asked Chico State Chico State came forward to us and said, well, there's this one process, but our campus is closed, and we'll have to ask administration, and the administration at the university allowed them to open up the labs for this injection molding process. That was a little less than 2 weeks ago, and that really changed everything, and that allowed them to produce the 600 a day. So it's really gotten rolling here in the last two weeks. And then Chico State produces the visors basically, and then they ship these visors hundreds at a time to Idea Fab Labs on Orange Street, and Idea Fab Labs and their workers cut out the shield and punch the shield holes, and then they send these to the doctors and healthcare workers. The beauty of these shields is that they are reusable. They worked on the design a long time so that they don't have any foam, any cloth, any tape, so they can be cleaned with cleaning solutions and used again and again and again. So that changed everything.
It's amazing. Well, thank you so much for your time today. This is a beautiful collaboration. I know it's going to bring a lot of safety to the people that need it most. And just thank you for sharing more with us.
Thank you, Carly. It's good to see you.
You too. Have a good day.
Thanks.